My name's Molly. I'm one of the licensed therapists here at Ried Physical Therapy, and today I just want to talk to you about shoulder impingement. This is something that we see quite often in therapy, and our patients tend to come in with a lot of questions about it, just unsure of what it is or what they can do to help themselves. So first off, the impingement within the shoulder is usually just a compression or a pinching of those tendons right in between the bones. So everything's getting a little tight, a little uncomfortable and irritated, and that can cause a lot of pain just within the shoulder or even down into the arm and into the hand. So there's many reasons for this to happen. One is overuse. So we typically see this in our athletes that use repetitive motions overhead. So take swimmers or tennis players, for example. The shoulder is just completely overworked and causes a lot of friction and tension within the tendons. And that can in turn cause the impingement and the issues that you might be having. It can also be caused from bone spurs, and this is typically from our older population, our elderly patients who have just degenerative changes within the joints. Those bone spurs can tend to pop up and cause just a little more friction and a little more pressure on those tendons. In more severe cases, tears can occur, and that's where we want to try to avoid if we can. Sometimes when we've used that arm too much and we continue to use it even if it's painful, the tears within the tendons can kind of pop up, and that's when surgery is required. So we want to do all that we can to help prevent that. My one piece of advice would be to just get ahead of it. If you feel like your shoulder is losing motion, if you have more pain than you normally do, if something's just not quite right, then talk to your doctor about it, talk to your local physical therapist, and see what your options are. Sometimes if you can get in there and get the right exercises and the right treatment, you might be able to avoid the surgery and the more invasive procedures to help your symptoms.